Thank you. Hello, everybody. And really big thanks to Diabetes India for this great invitation. I'm very happy to be for the first time in my life in Hyderabad, not in India. I've been to Mumbai, so hopefully I'll be visiting other cities. So, okay, so we're going to talk about diabetes care in low resource setting. And this is and should be a smart compromise. Thank you. Ooh, I like that. This is very considerate. Thank you. So, if you think in the developed countries, they still have challenges, imagine what's the case in the underdeveloped countries and in low middle income countries. But first, we need to agree on one thing, all of us here. Health is a human right. It should not, and it is not a privilege. Once we agree on that, I can go on with my presentation. This is good, Irina. Thank you. So first, let's go quickly over is this too high? Okay. Over the global context, the numbers are very high, and I appreciate the International Diabetes Federation because through the Atlas, I got a lot of information, and I invite you to do the same as well. So we have almost 600 million people with diabetes. This is one of the major contexts of nowadays, and it is a growing challenge. And the majority of the people affected with diabetes live in the low middle income country. This is a big invitation to go further and dive into what is happening in low middle income countries. Thank you. Okay. So we have, of course, inequitable access. We keep talking about equity, 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 but we don't see equity happening. If it is happening to be a bit positive, it's going very slowly, baby steps. And we have a lot of underdiagnosed and mistreated diabetes, especially in the low resource settings. Again, why are we talking about the low resource setting struggle? Uh, First of all, we have the low middle income countries, and then we have the countries in conflict. And usually they are in that category. So they are in low middle income countries, they have conflicts, they might have war. I come from a very conflictive country myself, and we have wars, we have disasters, man made disasters, natural disasters. We've seen a lot happening in the world lately. So this is again a pressing invitation and raising a red flag to look further into low middle income countries. And during the conflict, there is a disruption of medication, disruption of the supply chain. We have high proportions of underdiagnosed people. Why low resource settings struggle? Again, if you think of this, I'm sure many of you know the Maslow's hierarchy of needs. If we think the person has basic needs and those needs are not covered, how can we pretend they go into diabetes education, into digitalization, into health literacy? First, I need to eat, I need to breathe clean air, I need to have a roof over my head. So this is very important on why I'm talking about low middle income countries is in this. I don't expect you to read this, and I will not do. This is a mini list of the challenges and the barriers in low middle income countries, but I will focus on only few. I just put it there to scare you. Like, is she going to go over all those? No, I'm going to focus on some of them, which is first of all the limited availability and affordability. Sometimes you see the insulin, it's right in front of you. Do you have the money to get it? No. And this is sad. We really need to address that. And there is a high out of pocket cost. Many people are not insured. There is not social security valid system. The supply chain gets disrupted easily in low middle income countries, especially during wars. The weak primary healthcare systems. We do have some functioning, I doubt it. minimal portion of it functioning. So we need to work on that as well. And low health literacy. But again, we need to cover more basic needs in order to speak digital literacy, or like, how can you expect someone to know what is digital literacy if they do not have a smartphone, if internet does not get to their neighborhood? So again, we need to be logical in covering the needs before talking about other more developed needs. The cultural and language barriers. This is the main thing. Many guidelines get to be important. Are they good? They are excellent. Are they good for my country? Are they good for my people? That's to be seen. We need to adapt them to local context and many other more challenges. Now, as an example, I would like to introduce Dialab, which is the organization my daughter, who has type 1 diabetes, and myself founded 15 years ago. So this year is our 15th anniversary celebration. So it's a national diabetes organization working under the name of Dialab, which is Diabetes Lebanon, and founded, as I said, 15 years ago. We are now members of many international organizations. I would like to call your attention that the pictures are not from the internet. They are from real sessions. We have disclosures from our members to show these pictures. Um, so our core activities, they are about health promotion and education. Raising the awareness is one of our main objectives. We do social media outreach because we believe in the power of the media, the good side of the power of media and social media, because again, there is a lot of inaccurate information on social media. And we give lectures, awareness lectures in schools, universities, as you see in some of the pictures. The top right picture was one of the covers of our magazine. Those are real people living with type 1 and type 2 diabetes who are collaborating with us. And I think this is the best way to get to your community, working and collaborating with people from the community. Again, our core activities in the community, creating engagement with municipalities, with corporate sector, with ministries, and so on, in order to raise the level of awareness, and especially with universities, as you see here. And we do with them lots of physical activity events to motivate people to do physical activity. Thank you, Aisha, for raising the issue of sustainability, because it's topic dear to my heart. And you can see here that I wear the pin of the Sustainable Development Goals. How many are they? I don't want anybody sleeping here. How many are the Sustainable Development Goals? Okay, they are 17. Goal number 3 is the one which covers public health and the good health and well-being, but all the 17 are interconnected. So I spoke already about our program, and the screening and prevention initiatives are very important as they call attention on the importance of the topic, and we do organize that with the stakeholders I mentioned earlier, because we believe in early detection and that it is critical to prevention. We were happy to participate largely at the Insulin is Life campaign through our members who did videos, who did awareness at schools, who did talks, podcasts. And this was even on TV, on traditional TV, because this was an eye opener to many people to say, here we are 100 years after the discovery of insulin, and yet it's still unavailable and unaffordable to many people, and this is not what we want. So we have a feature event every year. We do it online. Few times we've done it in person, but because we like to invite prominent speakers, one of them was my dear friend Irina, present here, to shed the light on the importance of the topic of women and diabetes. Not because we don't want to talk about men and diabetes, but we women are fortunate enough to get gestational diabetes. You don't know what's that. So, I mean, you know, but you don't get it. So we are always special. That's why we need special events about women and diabetes. And Dialab is glad to share that we upgraded our policy in order to have a response to what's happening, to the emergencies. As I mentioned, Lebanon is a conflictive country. We've had wars, we've had lots of internal conflicts. We've had people migrating within the same country, people who are Lebanese coming from the south to Beirut area. We've had Syrian displaced people, Palestinian displaced people, you name it, we've had it in Lebanon. So we definitely had no choice but to have a good strategy as a response to the conflict. So, and in August 2020, or August 4th, a very unfortunate thing happened, which was the Beirut port explosion. I'm sure you all heard of it. It was heard about all over the world. So we needed to shift from just talking awareness and helping people with education to delivering medication, which is something that was not in our plans when I co-founded Dialab with my daughter. But when you see the need, you need to respond to the need. There is no other option. So this is what we did. And this, again, coming back to sustainability, to the sustainable development goals, and to gender balance, we are showing here that we helped equally men and women, 49% to 51%. And also, type 2 diabetes was the highest because people got displaced. They lost their glucose meters. They don't have their medication anymore. We have to respond to that. With our very limited resources, we take pride of saying we did a lot. So also, we have an initiative called Diabetes Medication for All. Uh, Again, it wasn't what we would like to do, but if we see the need in our people, we must do something. And this is what we have created. You can see the team and the ladies preparing the boxes of medication with the names, everything based on prescription. We don't get into diagnosis at all. They come to us with the prescription from their doctors, and based on our on whatever we have resources, we do that. So the smart compromises include rapid mobilization, and this is adaptation to crisis, mind you, and community network, prioritizing the continuity of insulin. You all know that people with type 1 diabetes cannot survive without insulin. It's not a luxury, it's not a choice, it is simply a must have. And the flexible service delivery models that meet people where they are. We used to have people calling us like, I cannot get to where you are. We needed to mobilize ourselves and take the medication to them. Again, from the Sustainable Development Goals, Dialab works so far on 4 of the goals, but indirectly, we work on technically all of them. This is to show you that throughout those 15 years, why am I showing this? Because I believe in the power of partnerships. And we need to seek partnerships no matter how small the organization is. So as you can see, we take pride of being part of all these organizations. And the recommendations for low middle income countries in crisis specifically would be to integrate diabetes into humanitarian response, to be ready for that, although you are never prepared or ready for a crisis, let me tell you by experience, but work on getting there, on almost becoming ready, strengthening primary healthcare so they don't get interrupted easily, ensure continuity for the displaced population. This is kind of almost impossible, but this is what we would like to see happening, and secure and protect insulin supply chain because we know that it can go bad if it's not well protected. Simplify clinical guidelines. We don't need complicated in order to do good. And embed the diabetes self-management education and support into the community. Leverage on digital health because it's a must nowadays. We cannot close the eye on it. And remember that context matters. You need to speak the same language and understand the realities of where you are before aiming unattainable goals. Partnerships, as I said, are very essential. So the call to action very quickly would be I think it was mentioned in the prior slide, but just remember that preparedness for emergencies ensures continuity of care. You are not 100% prepared, but it helps. I will finish by this quote by Martin Luther King, that of all forms of inequality, injustice in healthcare is the most shocking and inhumane. And he continues to say that it may lead to death. So here are my references, and thank you so much for being great listeners.
Thank you, Dr. Jack.